name is Kevin. Today's date is the 11th of May, 2015. I had a serious issue. Whenever I would lay down, I would always have my stomach upset and I would end up vomiting pretty much every night. I haven't thrown up at all since the surgery. I've been getting a lot more sleep because I don't have to worry about jumping up and going to the bathroom to take care of that issue. So it's been a great improvement. General health and status is pretty much a 100-degree turnaround from what it was before. I would recommend it to anybody who needs to come through this venue for any services that they render.
Okay. Well, good morning. Could you
Good morning.
please just tell us what actually brought you to the practice here at Chesapeake Vein Center and Med Spa?
Yes, actually, I had gone to my doctor and just told him that I had always kind of had some complaints with heaviness in my legs and feeling like I had bruises all over my legs all the time. And they were real tender to the touch. My feet stayed cold all the time, and I teach, so I'm always on my feet. So it was just one of those things that I didn't know if it was something that I could change or not. And my doctor sent me to Dr. Challa to see if there was something he could do for me.
Okay. And what procedures did you have done?
I actually had 3 procedures done. I had 3 closures done, 2 on my right and 1 on my left leg.
Okay. And what kind of results did you get from the procedures?
Actually, the downtime was very quick. With me being on my feet all the time, I basically took the next day off just for myself, just to get used to everything. And I was back in action within like the second day, able to stand up. I no longer have any problems with my feet anymore. My feet aren't cold anymore. My legs aren't tender to the touch. My legs don't tingle and fall asleep anymore. Basically everything that I had originally complained about, I don't have any more problems with it anymore. So it's been wonderful.
And how long has it been now?
I came in almost a year ago just to start getting my first ultrasounds done, and I would say I started the procedures in October and November. So now I'm on my 6th month out.
Great. All right.
All the
Thank you very
procedures.
much.
Thank you.
All right.
Fear no mirror. Know you always look your best. Get rid of stubborn fat without surgery or downtime. Love handles. Muffin tops. Areas that have unwanted fat. No crash dieting. No extreme exercising. It's cool. Sculpting. The clinically proven non-surgical procedure that literally freezes away stubborn fat without any damage to your skin. Because fat cells are more vulnerable to cooling than the surrounding tissue, by delivering controlled cooling to an area, we can induce fat cell elimination naturally over time. As a non-surgical procedure, Cool Sculpting is the perfect fit for people who would normally not consider cosmetic surgery or don't want the associated downtime and risks. Cool Sculpting creates satisfied patients.
I like to wear fitted shirts, and now I can.
So yes, I'm very happy with the way I look and have a lot more confidence now.
Cool Sculpting is an easy, same-day procedure. Patients can just read, check email, or relax. Best of all, there's no downtime, so you can immediately get back to your daily activities.
It did wonders for my confidence.
Cool Sculpting treats virtually any area of the body that needs help. Stomach, waistline, flank, inner thigh, outer thigh. It's more than a treatment. It's a transformation. Best of all, Cool Sculpting results are long-term. Once the fat is gone, it's gone for good. Now that's really cool. Cool Sculpting by Zeltiq. During your appointment, please ask if Cool Sculpting is right for you.
Looking to reduce some of those softer spots on your body for the summer, you might be a good candidate for a procedure called Cool Sculpting. So here now to tell us a little bit more about it is Dr. Surya Challa from Chesapeake Vein Center and Medical Spa. And what exactly is Cool Sculpting?
Cool Sculpting is a non-invasive body contouring procedure. It precisely targets body fat under the skin by cooling it without causing any damage to other organs. And the areas it targets are what we would call muffin top, bra roll, love handles.
So all those areas that the women
saddlebags,
worry about.
yes, so stomach, back, and flanks, and thighs, etc.
How exactly does it work?
It chills the fat down, and the fat then gradually is eliminated over time naturally without surgery.
Okay, so this is better than just taking cold showers, right?
It is absolutely better than taking cold showers, and it allows people to really show off an enhanced curve, hourglass type figure for women, especially when you're wearing form-fitting dresses.
Okay, that sounds really good for any woman or even a guy out there. So is there any pain or downtime associated with this?
No, it's very comfortable. When I had my Cool Sculpting, I had no pain, no downtime. I was watching TV actually for the hour I had the procedure.
You were watching TV?
Absolutely.
While you were being cool sculpted?
Absolutely. And that's what most people do. For the first few minutes, there's a sensation like if you put your hand in a bag of ice,
okay,
and then that just fades away and you're just watching TV.
Is it painful, or you just feel fine?
I had no pain. There's some tugging when they put the applicator on, and that's it.
Okay, how soon can you start seeing results?
The initial results are seen as early as 3 weeks, and then the most dramatic results come in at around 3 months. And I like it that way because it allows the body to adjust instead of suddenly losing and deflating like a balloon.
Right.
So it slowly adjusts the skin as you lose the fat.
So what would be, if you were to compare it, would it be something like lipo or gastric bypass? What do you recommend Cool Sculpting over those procedures?
If you are looking for a non-invasive, mind you, liposuction is invasive,
okay,
tubes coming out of your body, a bunch of weeks off, time off, garments. So if you're looking for a non-invasive procedure, you have those extra few pounds you want to lose. This is a very luxurious, very nice way to get it done without altering your day-to-day life while it's being done.
Okay, and who would be a good candidate for this? This is a little bit of a personal question, but I have some love handles. Not going to lie here. I work out a little bit, but there are those areas that are hard to work out and get rid of.
And
would a thin or a fit person be a good candidate?
It's funny you brought that up, love handles. We have an event on July 9th called Lose the Handles, Keep the Love.
I love it.
It's meant specifically for this exact thing you brought up.
Okay.
It is targeted to contour away those extra layers so that you can have a form-fitting type of a figure. And for men who want to have that athletic V-shaped figure, you can use the procedure to kind of core away at that sides to give that figure. So it is meant specifically for people who want to hourglass their figures or V-shape their figures. We also can debulk some fat, but this is not like liposuction where you may lose a whole bunch of body fat with a lot of surgery. This is where you come in, get it done, and go about your life while the procedure works its way.
Were you pleased with your results? Do you have the V?
I dropped a pant size right after I had the procedure done. Very happy. My wife said, "What happened to the pooch you used to have?" I said, "It's gone."
Any specials going on?
Every month, but July 9th we have an event where people can meet our Cool Sculpting team leaders. They can see before and after, and they get a $100 gift card for the first 10 to attend to get cosmetic services.
The first 10, so there you have to come back and kind of do repetitious.
The first 10 people who attend get a $100 gift card. And there's also event specials at that event. People can go to our website, ChesapeakeVein and MedSpa.com, or Facebook.
And this is where they can learn, of course, a little bit
They
more
can
about
learn
this.
everything about it.
Sounds absolutely wonderful. Thank you for joining us on our show this morning.
My pleasure.
Of course, if you'd like to learn a little bit more about this cool sculpting, you can call Dr. Surya Chawla at the Chesapeake Vein Center and Medical Spa. They're at 300.
Well, welcome back to the Hampton Road Show. Fine lines, wrinkles, and sun damage, they can make you look a lot older than you actually are. So Dr. Surya Chawla from Chesapeake Vein and Med Spa is here to tell us how Halo laser skin resurfacing treatments can actually help you repair damaged skin. Good morning, Dr. What should we call you? The angel doctor? Because how do you get rid of wrinkles? What is this Halo treatment?
Well, good morning. Halo is a type of laser treatment. It's rather revolutionary, and it is for people looking for smoother, fresher-looking skin.
Who doesn't want that?
And I think everyone does, yes. And that's the beauty of this treatment. You can offer it to a lot of different types of people. It's very minimally invasive, very little downtime, and it's really exciting.
How does it work exactly? You say it's not very invasive, so it sounds very light.
Yes. So it's essentially you're pouring pure light like a laser, and it's not invasive because the older lasers, you had to go deep to do their job, and surface layers could not be affected properly with surface lasers. This particular system combines the deep and the surface in a very technologically great manner to make a process that used to take a lot of downtime in the past down to almost no downtime for someone in a very comfortable fashion. So you could go out after this treatment, a couple of days out, and with makeup, no problem. Previously, it used to take a couple of weeks if you
Oh, wow. Big
got a
difference.
treatment like that.
And what does it feel like?
It feels comfortable. There's a numbing cream that's put on, and most people tell me it's a little sensation of like a sunburn, mild sunburn the next day.
Okay.
During the treatment, just a little bit of heat sensation. That's it.
Okay, and when you talked about downtime, what kind of results can you expect to see? And again, go into the downtime, if there is any.
Well, for lighter treatments, there's virtually no downtime. For the deeper treatments, 2 to 5 days. And even folks with the deepest treatments, about 2 days out can wear makeup and walk around. Yeah, and the type of results that you're looking for, folks who have sun damage, wrinkles, spots, like red and brown spots, those are the folks that really get this glow after the treatment. It's almost like turning the clock back a bit.
So I have a unique question. People who have darker skin tones, like me, or browner skin tones, they should stay away from chemical peels, right?
True, because chemical peels basically thin down the skin, and
Okay.
that's not what you want to do. You want to rebuild the skin, and that's where lasers are so much better. Because instead of peeling the outer layer off like you do with a peel,
Right.
a laser would basically remodel the collagen to build up a new skin.
So who would be a good candidate for this type of treatment?
We basically customize this to all levels, but 2 particular types come into mind. The late 20s, early 30s to do some preventative type treatments, and the older folks who have sun damage, wrinkles, spots, etc. They need corrective treatments, and they do fantastic.
And again, it's good for people that have skin tones that are a little bit browner, like ours?
Yeah, absolutely.
Okay.
I mean, this is our skin tone, perfect.
Oh, okay. And you have my brown skin color, so you would know about this.
Absolutely, yes.
Well, we want folks to get involved with this. If you would like to see your face look a little cuter, go to the Chesapeake Vein and Med Spa, 300 Medical Parkway in Chesapeake is where they're located. Give them a call at 517-3297, or you can go online at ChesapeakeVeinandMedSpa.com. Thanks for coming on to the show this morning.
My pleasure. Thanks for having me.
Welcome back to the Hampton Road Show. Gallbladder removal surgery is one of the most common surgical procedures performed on women. Here now to tell us a little bit more about this procedure is Dr. Surya Chawla, board-certified surgeon from the Chesapeake Vein Center and Medical Spa. Good morning. Welcome back onto the show.
Good morning. Thanks for having me.
So, stomach issues and the gallbladder. What is the gallbladder?
It's an egg-shaped organ right below the ribs on the right side. It's very appropriate to talk about it because I see a lot of folks in the holiday season. You know, we all love to overindulge and family get-together, etc.
Not me. No, I don't know what you're talking about. Fatty foods, what?
Exactly.
What is that?
You said it. Have this nice big greasy meal, and so yeah, those things tend to upset the gallbladder, which helps digest fat. For example, if you have a piece of pizza, the body sends a signal to this gallbladder to push out some fluid to digest that pizza.
So you upset the gallbladder. You can't just have a conversation with it. You can't just say, look, just
you can
calm
kind
down.
of be moderation, but I think the way to think about it is everything in moderation, really.
How do you know if you have issues with the gallbladder?
Folks I see come in saying things hurt right below the ribs, or
Okay.
they get nauseous, they feel bloated, they don't really feel well
Do
after
they get
eating.
gassy?
Gassy,
Okay.
so there's
Common symptoms.
indigestion.
Oh, right. And so how do you know to avoid these types of issues? It's just the eating or?
Eating, don't eat heavy, fatty, large food, amounts of food, exercise every day, the usual 30 minutes a day for 5 days, and maintain a healthy weight. There are some genetic issues here, but even otherwise you can slow down the manifestations by doing the right things.
So how does your practice come into play? How can you help if the issues are beyond just doing what you can at home?
Well, I'm very excited to share the latest advances in this field, and that's helpful for the viewers because traditionally the way that gallbladder surgical issues could be handled was with a large cut.
Oh, wow.
So then about 15 years ago, we started putting small cuts and long little instruments that get into the body. One of the instruments had a little camera at the tip, so the surgeon could watch the operation on a video monitor while doing the operation. So that was about 10 years ago. Now, I'm very, excited and actually proud to share that we have the latest advances. Your viewers can go to Chesapeake Vein and Med Spa to look at the latest advances, but essentially this is what it comes down to. Virtually scarless surgery using flexible instruments. I control a robot that works with me to get those instruments in and take the gallbladder out.
Very interesting. And recovery time really quick because we're running short on time.
It's about less than a week. It's outpatient stay. You go home a couple of hours after.
Dr. Surya Chawla, thank you so much for coming on to the
my
show.
pleasure.
It sounds like a great procedure
Yes.
and something that has minimal downtime.
I think that's right.
Like you said, very minimal downtime. Visit them, Chesapeake Vein Center and Medical Spa. Give them a call at 517-3297, or you can go online and see all of these wonderful advances in medicine at ChesapeakeVeinAndMedSpa.com. Thank you so much for coming on to the show. Well, welcome back to the Hampton Road Show. Fine lines, wrinkles, and sun damage, they can make you look a lot older than you actually are. So Dr. Surya Chawla from Chesapeake Vein and Med Spa is here to tell us how Halo laser skin resurfacing treatments can actually help you repair damaged skin. Good morning, Dr. What should we call you? The angel doctor? Because how do you get rid of wrinkles? What is this Halo treatment?
Well, good morning. Halo is a type of laser treatment. It's rather revolutionary, and it is for people looking for smoother, fresher-looking skin.
Who doesn't want that?
And I think everyone does. Yes, and that's the beauty of this treatment. You can offer it to a lot of different types of people. It's very minimally invasive, very little downtime, and it's really exciting.
How does it work exactly? You say it's not very invasive, so it sounds very light.
Yes. So it's essentially you're pouring pure light like a laser, and it's not invasive because the older lasers, you had to go deep to do their job, and surface layers could not be affected properly with surface lasers. This particular system combines the deep and the surface in a very technologically great manner to make a process that used to take a lot of downtime in the past down to almost no downtime for someone in a very comfortable fashion. So you could go out after this treatment, a couple of days out, and with makeup, no problem. Previously, it used to take a couple of weeks if you
Oh, wow. Big
had a
difference.
treatment like that.
And what does it feel like?
It feels comfortable. There's a numbing cream that's put on, and most people tell me it's a little sensation of like a sunburn, mild sunburn the next day.
Okay.
During the treatment, just a little bit of heat sensation. That's it.
Okay, and when you talked about downtime, what kind of results can you expect to see? And again, go into the downtime, if there is any.
Well, for lighter treatments, there's virtually no downtime. For the deeper treatments, 2 to 5 days. And even folks with the deepest treatments, about 2 days out can wear makeup and walk around. Yeah, and the type of results that you're looking for, folks who have sun damage, wrinkles, spots, like red and brown spots, those are the folks that really get this glow after the treatment. It's almost like turning the clock back a bit.
So I have a unique question. People who have darker skin tones, like me, or browner skin tones, they should stay away from chemical peels, right?
True, because chemical peels basically thin down the skin, and
Okay.
that's not what you want to do. You want to rebuild the skin, and that's where lasers are so much better. Because instead of peeling the outer layer off like you do with a peel,
Right.
a laser would basically remodel the collagen to build up a new skin.
So who would be a good candidate for this type of treatment?
We basically customize this to all levels, but 2 particular types come into mind. The late 20s, early 30s to do some preventative type treatments, and the older folks who have sun damage, wrinkles, spots, etc. They need corrective treatments, and they do fantastic.
And again, it's good for people that have skin tones that are a little bit browner, like ours?
Yeah, absolutely.
Okay.
I mean, this is our skin tone, perfect.
Oh, okay. And you have my brown skin color, so you would know about this.
Absolutely, yes.
Well, we want folks to get involved with this. If you would like to see your face look a little cuter, go to the Chesapeake Vein and Med Spa. 300 Medical Parkway in Chesapeake is where they're located. Give them a call at 517-3297, or you can go online at ChesapeakeVeinandMedSpa.com. Thanks for coming on to the show this morning.
My pleasure. Thanks for having me.
And now we are back in the kitchen with Caroline Fornshell, registered dietitian, nutritionist, and founder of LWell Longevity Wellness and Fitness in Yorktown. And she's showing us this morning how to make a dish called quiche tassel.
People have lots of options for hair removal. For most people, though, the best option is one that is fast and thorough and as comfortable as possible.
I wanted to remove hair on my bikini area. I had tried everything for hair removal, from shaving to waxing to threading, and nothing seemed to work. I had tried another laser prior to ClearScan, and it was very uncomfortable, and the process took a lot longer. And the ClearScan laser was comfortable, and I didn't notice too much pain during. It was mild, as to be expected, and afterwards there was no pain at all.
What I've seen is just, hairs turning under the skin. You can shave every day. Most people say you shave every day. That'll solve the problem. That does not solve the problem. All that does is sometimes make the problem worse.
ClearScan from Sciton is the solution for permanent hair reduction for all skin types, including dark and tanned skin. ClearScan is effective. It delivers the ideal wavelength for permanent hair reduction. It achieves permanent hair reduction through selective targeting of the melanin that's found in hair follicles. Its deep penetrating wavelength and correct pulse width can penetrate to the deepest follicles.
What I've seen is the hair has gone from a very coarse type hair texture to a very fine hair texture. So the hairs turning under aren't as common. They're actually, I don't shave as much. I shaved this morning just because I knew I was going to be sitting in front of a camera, but I probably shave once every other day now. And hopefully I won't have to shave at all soon.
I love the results. I'm very excited. They are exactly what I wanted. I don't have to think about body hair as much anymore, and I went to the beach this summer, didn't have to worry about anything, and I'm really excited about it.
ClearScan is fast. Its technology delivers precise and consistent results. The computer-guided scanner covers large areas rapidly and evenly for maximum reduction in each treatment.
I was really surprised because I thought it was going to be more painful, it was going to take longer, maybe even be some downtime, and there was none of that. It was quick, it was efficient, and it was pretty painless.
ClearScan is designed for patient comfort and safety. With its powerful integrated cooling system, ClearScan gives your physician precise control over cooling, including full skin contact for maximum comfort before, during, and after treatment.
Well, this is the nice part about this treatment. The downtime, I didn't see any real downtime. I would get treatment and I would go right back into the office. There was no pain associated with it. I didn't have to go home and put ice packs on my face. I didn't have to go hide.
There was no healing process. It was just as simple. It was probably even more comfortable than going to get a wax or something. It was more comfortable than that.
Permanent hair reduction requires multiple treatments. Your physician will determine the number of treatments that are right for you. Over the course of your treatments, most hair will be permanently removed. The hair that does regrow will be finer and lighter than before. The ClearScan system can be used on just about any area of the body: the lip, the face and bikini line, the arms, underarms and legs, as well as the back.
If somebody is considering doing the ClearScan laser, I would definitely recommend it and suggest that they do it right away, because the sooner you do it, the quicker results you get.
Do it. Do it. If you have a problem, if you want to get it dealt with, do it. It's the easiest, painless, cost-effective treatment that I've seen, period. And I've tried a lot of them. And I've even bought home products over the internet. They don't work. So I've tried a lot of them. I say do it.
Permanent hair reduction for all skin types, including dark and tanned skin. Robotic scanning technology for fast and consistent results. And an integrated full contact cooling system for patient comfort and safety. That's ClearScan from Cyton.
I think we found the fountain of youth.
A new trend that doctors say is bringing back youthful skin with no needles and no pain. There are endless potions and creams that promise to turn back the clock on aging. We all know that. But there's a new study out of Stanford University which shows that there is solid science behind at least one high-tech anti-aging tool. Ground Force Vicki Liviakis looks into the laser, which uses light to make cells younger.
You're looking at a skin laser treatment so bright, normally you'd have to wear dark goggles. It's the blinding light that's not only making skin look younger, but is actually causing the skin cells to become younger.
We took the old skin and reversed the gene expression to a large degree to that of youthful skin.
That's right. It's actually changing the DNA of skin. A new Stanford clinical study shows that rather than just a cosmetic mimic of young skin, what's going on here is altering human genes associated with the aging process. And plastic surgeons like Dr. Elizabeth Lee of Berkeley and Lafayette are impressed.
It's kind of as close to the fountain of youth as we actually have.
The laser is called Cyton Broadband Light.
People started asking me what I was doing with them, what I was using on my skin.
Michelle is receiving the broadband light treatment here at Spa Radiance Medical in San Francisco to try and improve her skin.
Well, definitely. I mean, all the skin on my body has changed as I've gotten older.
And after 4 sessions, you might be surprised to know Michelle's real age.
I'm 43, almost 44.
People in their 40s and 50s are still producing a lot of collagen. They're going to get a better result, say, than someone who's, 70.
Your cell goes back to how it was 10, 15 years before. So literally, the cell becomes younger.
This is science. This is science.
I think we found the fountain of youth.
In San Francisco, Vicki Liviakis, KRON 4 News.
Well, the broadband light therapy is currently being used by a number of dermatologists and plastic surgeons in the Bay Area, mostly to treat skin damage from too much sun. But now that the Stanford study is out and showing that there are other anti-aging properties, you can imagine that that therapy will likely be in high demand.
I just had the Sciton Halo laser treatment and it was very easy. I was very well cared for and I cannot wait to see the results in a few days. This is exciting.
My name is Kristen Farrell and I host a TV show based here in Lake Tahoe. It's a live TV show and we cover all things Lake Tahoe. So in covering those things, we need to be familiar with them. When it gives me the opportunity to go be outside and enjoy the snow in the winter and the kayaking and the paddleboarding and the hiking and the biking in the summertime. So it encompasses everything that I love to do outdoors. I am outside all the time. I also have 2 young kids who I have with me all the time who love to be outside too, so I'm chasing them. I was always the one who had to be the most tan. To me, it showed that I had been outside. It was the healthy glow. That's what I perceived it to be. As I got older, into my mid-30s, I started to realize that kind of treatment to my skin started to catch up with me. I started to notice sunspots, a lot more wrinkles, and it definitely showed up more when I was on camera. And so I was having to put on more and more makeup in my daily life and to go do my job, to be on camera. So that's what brought me here, to fix some of that sun damage and to restore a more youthful appearance to my face. I think we're all our own worst critics. We've all looked in the mirror very closely at ourselves, and I surely had many of those mornings where I got up and looked in the mirror, and it was just one day where I said, I cannot look at splotched skin starting to age prematurely because of the sun damage and the damage I had done to it for one more day. And that's what made me pick up the phone and call Dr. Gelber, and we reviewed the options and decided that the Sciton laser resurfacing treatment would be the best, and it absolutely has been fantastic.
Halo has been the best of both worlds. It's the very first hybrid fractional laser, and it allows me to deliver to my patients the results of an ablative procedure with the downtime of a non-ablative procedure. And that is the best of both worlds. So you can decide how much ablation and you can decide how much coagulation you're going to use. Regardless, you will see a significant improvement in your patient's sun damage. You'll see an improvement in tone and texture. And particularly when you use more ablation, you can actually improve wrinkles. These are all things our patients want, and when you can deliver them with a simple, easy treatment, they'll love it.
It was about day 6 where I was able to look at my skin and go, wow, that is night and day. Literally daily, I get to hear people say, your skin is just beautiful. Right after I did go back to work and I hosted my first show post-treatment, I got compliments. People wrote into the show saying your skin looks amazing. Other hosts of different shows that are taped throughout the day at the TV station came in and said, wow, what did you do? Your skin looks incredible. And I was proud to say, I don't have much makeup on at all. This is exciting. I'm turning 40 this year and I look forward to maintaining a very active lifestyle that includes being outdoors a lot. And that's why I'm back 1 year later after my first Sciton laser resurfacing treatment. I'm looking forward to seeing what the latest is in technology now and maintaining healthy skin throughout the rest of my life. It feels really, really good to know that I did the right thing for my face and for my job and for my future. Feels good to look in the mirror and see that.
The feedback that I've gotten largely from patients over the years that have used broadband light has been that they prefer the treatments because they see, number one, a better result. Number two, the treatments are easier for them to have done. And number three, treatments are faster and quicker. That has given us a better result, faster results, and a greater degree of overall rejuvenation of the skin.
All right, well, whether
Whether you're dealing with sore and aching legs or if you're worried about varicose veins, our next guest can actually help you. Joining us now is Dr. Surya Chawla from Chesapeake Vein Center and Med Spa to tell us a little bit more. Welcome back to the show, Doctor.
Thank you for having me.
So, mostly women, but men too, they deal with these venous problems. Tell us a little bit more about it and varicose veins. Are they the same?
Varicose veins are a type of presentation of venous problems. Lots of people have leg swelling, aching, heaviness. In fact, majority of people I see have heaviness and aching. And sometimes men and women too occasionally present with big varicose veins. That's one segment of this issue.
When should people start realizing that they have a problem and they need to seek some kind of help about this?
You know, in your day-to-day life, if you feel that your legs hurt a lot by the end of the day, or your legs swell, you feel like you have to put your legs up by the end of the day, or you have big veins or some skin changes at the ankle, those are the types of things that should tell you that maybe this needs to be looked at by a vein specialist.
What kind of treatments are available out there? What can you help people with if they deal with those issues?
At the basic level, I'd advise anyone who's engaged in a lot of activity involving standing, etc., to wear some sort of a compression on their legs. I run, and when I run, I wear compression sleeves that really help, for example. But we have lasers, we have very non-invasive treatments, helped a couple of thousand people at least with these type of non-surgical treatments, should they need it. Not everyone does.
How would you go about diagnosing the issue?
Are you aware of an ultrasound, the non-invasive test women get when they're pregnant? So we have a version of that that checks the leg veins, so we can easily do it in about 45 minutes.
So you're getting a very accurate diagnosis. You're not just thinking, oh, I have a problem and...
Well, as I was saying, as soon as I lay my eyes on someone, with the experience we have, I can tell. But the confirmation is always with an ultrasound that either proves or disproves it.
And again, what type of improvements do your patients report seeing after they've had the treatment that you're recommending?
You know, and I'll go back to my website, Chesapeake Vein and Med Spa. There's a testimonial page full of people who kind of detail their improvements. Majority of the time, what I hear is this non-specific type of feedback saying, Doc, my legs feel so much better. Or people say, my legs don't hurt anymore, they don't swell anymore, thank you, I can walk 2 blocks, things of that nature. Tell me, you know, you do a really good quality of life improvement day to day.
And it's not just something that affects older folks. I remember in my 20s, I started getting this random swelling in my ankles. So should people always be looking at their health and, you know, looking for changes in the body?
Truly, that is correct. Every decade this progresses because the causes are genetic. The manifestations come on with your type of lifestyle you lead, but it's genetic. So women in their 50s, for example, may have a lot more of these than women in their 20s, but certainly it's a good time to look down and see what's going on.
What's going on with your body. Thank you so much for coming onto the show this morning.
My pleasure.
And we want our viewers to know where they can learn a little bit more about Dr. Surya Chawla's treatments at Chesapeake Vein Center and Med Spa. They're located at 300 Medical Parkway in Chesapeake. Give them a call, 517-3297. You can also go online at Chesapeake Vein and Spa, veinandmedspa.com. Thank you for coming onto the show.
Benign vascular lesions are a common problem for many people. Fortunately, these lesions can now be treated with laser therapy, meaning fast, effective, and safe treatment with maximum patient comfort.
I had veins around my nose and some on my legs, so I had redness around in here.
I had 2 people that I trust and that are friends that had mentioned that I had those veins going down, and one of them was telling me that I should get it taken care of, that he had it done, and it was a simple process, inexpensive, and the result was fantastic, and he felt much better about himself. The second friend of mine I hadn't seen in a long time, and he actually thought I had been scratched by a cat, and I thought at that point it's time to take the first person's advice and get this taken care of.
ClearScan from Sciton is the solution for vascular treatments for all skin types, including dark and tanned skin. ClearScan is effective. It delivers the ideal wavelength for virtually all vascular lesions, allowing your physician to precisely treat visible vessels, broken capillaries, spider veins, and lesions. For larger vessels, ClearScan's wavelength penetrates and uniformly treats the entire vessel. It also penetrates deeper into the skin as compared to other laser options. For smaller veins, ClearScan allows your healthcare provider to deliver the precise amount of heat at the desired length of time to effectively cause the vein to disappear, allowing new vessels to replace its function.
It was great. It was almost like going in for a teeth whitening. When I left, I didn't have any veins in my chin. And the whole way driving home, I kept looking in the mirror. I couldn't believe what happened and why I waited.
I treated the veins that I could see wearing shorts. They were just bothering me, and they were just spider veins. So I had just one treatment, and they went away.
ClearScan is fast. Its robotic technology delivers precise and consistent results.
It took about 30 minutes, and they were removed completely. As soon as I left here, I went back, showed my wife, and returned to work.
ClearScan is designed for patient comfort and safety. With its powerful integrated cooling system, ClearScan gives your physician precise control over cooling, including full skin contact for maximum comfort before, during, and after treatment.
Felt like a rubber band snapping. That's only the best description I can say is maybe someone snapping a rubber band on me.
She said I might feel a little bit of pain in the beginning, but I really didn't feel any pain, just the short shock. And after that, you got used to what it was going to be, so it was just a quick little zap. So there was absolutely no pain.
Vascular lesions may require multiple treatments. Your healthcare provider will determine the appropriate number of treatments needed to achieve optimal results. The ClearScan system can be used on all skin areas. Popular areas are the face, the neck, the chest, and the legs.
I'd do it again. I'm very happy with the results, and it took care of it on one try. I was really happy with that.
It was a relief when they were gone, and they were gone like that. And it was a great experience. One of those things I wish I would have done 5 years ago.
ClearScan, the solution for virtually all vascular lesions, including small surface vessels and deeper, larger veins. Technology that ensures fast and consistent results, and an integrated full contact cooling system for patient comfort and safety. That's ClearScan from Cyton.